Welcome NSU students for another exciting workshop, part of our telehealth case competition, but valuable for all pre-health students. Today we're dealing with an exciting topic, how to deal with difficult patients, something that no matter what area of healthcare you're gonna go into, doctor, dentist, PT, OT, you're gonna run into someone that isn't so happy to be there. And that might be for some underlying causes or just being upset on the situation. And so hopefully today we're going to be going over some strategies, tips that can help you deal with that. It's also going to help you prepare if one of you are selected for our live competition on how you're going to be able to deal with that patient scenario. So for the first half, I'm going to turn it over to Sergeant Allen, who is always so generous with time and sharing his insights. Sergeant Allen, I'll turn it over to you. And if you'd like to share your screen, please go for it.
Yeah, absolutely. Thank you. I'll share a screen real quick. All right. So today we're talking about dealing with difficult patients. As Mr. Lorenzo told you, I'm Sergeant First Class Allen. I'm a healthcare recruiter with the Army. Been dealing with the healthcare industry for a good 15 years now, so I've dealt with my fair share of difficult patients, that's for sure. So today, the overall agenda is just going to be kind of understanding why those patients are feeling the way they are or acting the way they are, different types of difficult patients, and then some tips on how to deal with them. So when it comes to difficult patients, you got to understand that there's a bunch of different reasons that could be causing them to be difficult, but there's usually one common reason or factor that just about every patient is going to be experiencing, and that's that they're dealing with something, whether it's an illness or an injury, or they have to come in for a physical, or if you're a dentist, like a cleaning or something. And so that alone can cause them to feel anxious and nervous or afraid. So you really got to kind of be aware or conscious of how they're feeling, what they're feeling, and then how those feelings can manifest. They can manifest in a number of different ways. So you just want to be aware of that, and then make sure you have the proper coping skills or mechanisms to deal with it when it does arise. So with that, we'll go into the next little section is going to be kind of just breaking down the different types of difficult patients that you may come across, starting with angry patients. And that can kind of be a tricky one because the sources or causes of the outward display of anger can be very, very vast. One of the main ones could be fear. They could be frightened and reacting to that fear because they're afraid of their illness. They could be afraid of coming to the doctor. They could be afraid of just the unknown of not knowing what's going on with their body. So many different things, and they can act out in anger because of that. And so it's important as a medical practitioner or provider to kind of step back from that angry person or patient and try to assess and figure out what is actually going on. And then depending if they're frightened or if they're just angry because they waited too long in the waiting room and they expected to be seen right away, or whatever the case is, you're just not meeting their expectations. And so you kind of have to approach them differently based on what's causing that anger. So the safe course of action is to communicate with the patient and try to assess their feelings. Use empathetic statements such as, I understand what you're feeling or what's going on, where you're coming from, and then try to resolve those issues and move forward. Find a common ground that you both can come to an understanding and hopefully resolve that anger issue and then give them effective care. The next type of patient that we're going to talk about is the manipulative patient. This is one of the more common ones that I've seen personally. And so the manipulative patient likes to threaten, cry, throw tantrums in an attempt to seek attention or get their way. Simple strategy for dealing with this kind of patient is to just stay level-headed. Don't engage in a heated argument with them, because if you're arguing with them, you're giving in to what they want. And then a lot of times these patients are kind of stuck in their belief or their position, their perspective, and they're not going to see it from a different perspective or viewpoint. They're going to stay with what they think. And then they also try a number of different tactics to convince you just to give them special treatment or to do as they demand. It can be very frustrating because they're trying to just twist and turn everything around on you to get what they want. And your best bet is to kind of just take a breath, stay calm, stabilize your feelings, and recognize that they're trying to manipulate the situation in their favor. And don't let your own emotions overpower your sense of judgment, so that you can still continue to give them good, effective care without kind of letting them have their way with the whole appointment or the whole encounter. So the next type of difficult patient that you see, at least that we see probably a lot of these, they piggyback on each other as well. So if somebody's angry, they can use their anger to manipulate the situation and act out aggressively. So they all kind of can feed into each other, but I just break them down to make it simple. So research shows that nearly every single medical staff, whether it's a nurse, doctor, dentist, or whatever, has dealt with an aggressive patient at some point. And that's just somebody behaving disrespectfully. Sometimes they are being verbally abusive, or it can elevate to them throwing things at you, or full on just the patient coming at you on the attack. Obviously, that's worst case scenario. You don't want that to happen. So while you and your staff have to deal with aggressive patients, staying calm is the biggest tip that you can have. Is just keep calm, let them yell and scream and throw their temper tantrums, and just you be the level head in the room. So a lot of times they will act aggressively again just to manipulate you and get what they want, or because they're just mad. And then the effect that can have on your staff is paramount. Whether that's a physical injury because they full on attacked or threw something, or if it's the emotional toll that it's going to take, because a lot of times you getting yelled at it can impact you emotionally as well. Like, oh my goodness, you might start feeling that you're failing as that provider. And that's not the case. You just got to remember that they're acting aggressively for whatever reason. Try to figure out what that reason is, so that you can, again, come to a good understanding to move forward. And a good way to do that is just to step back, both physically and figuratively, and then you can evaluate the potential cause of their aggressiveness, and again, gain that understanding to move forward from there. The next one is the grieving patient. This one is a little bit tougher to deal with, in my opinion, because a lot of us can relate to it. And a good place to start in order to understand the effect that the grief is going to have on that patient and their health is to know the stages of grief, so that you can familiarize yourself with what they are and what stage that patient might be in, as well as help them recognize it and move forward or continue along the natural process of grief. You can look around for the signs and symptoms of the grief and how it's affecting their physical health or their mental health. And then just make sure that they understand that it is a process and it does take time, a different amount of time for each person. Like, everybody processes grief on their own timeline. It's not like a set, oh, it's day 5, you should be in this state. That's not how it works. So just make sure they understand that, so they aren't beating themselves up thinking that, they're still grieving when they shouldn't be, because it does take a while. And then you want to validate their grief by making sure that you reassure them that it's a normal thing. Like, everybody processes grief and everybody's going to experience that. And so they need to just know that they're not alone, and then keep those open lines of communication and give them the resources that they would need to communicate and talk to a professional or whoever, if the case dictates that being necessary. And then just allow them to come to you, essentially, so that you can treat whatever the ailment is as best you can, but just be as understanding and as empathetic as you can be. And that will usually end with a positive result. So like I said, the toll that this can take on your staff is huge. So you just want to be aware that you're talking to your peers and your staff, and making sure that everybody's doing okay, especially after a difficult patient has come through. Debriefing and kind of evaluating what happened and how you could improve, or if everyone did everything they could to help that patient. And so that you learn from the experience, as well as processing the emotions that are going to come with it. So some of the tips that we have to deal with it, this is where it gets a little bit more fun and a little more applicable for you guys. The number one tip is to stay calm. Just knowing that the aggressive behavior is not because of you is the way to go. Usually, almost always, it's going to be because of an outside factor. While it's easy to think a patient is upset because of something you did, that's almost never the case. You should continue to do your job and try not to let their negativity get in your head. It's tough. It's tough. I fully understand that that can be very difficult, but you got to do your best. The next tip I would say is be empathetic. It's one of the most effective ways to calm an angry patient is by being empathetic with them, showing that you understand how they feel or why they feel that way. And you have to remind yourself that it's not easy to be battling whatever it is they're going through, whether that's a disease, an injury, or just an illness, whatever. It's not easy. It takes its toll. It's stressful on them. There's fear involved. So you got to try to help them realize that, hey, maybe this is why you feel the way you do. Rather than being indifferent or kind of standoffish, try to be concerned about your patient's well-being and treat them with respect. That is a big one. Showing that you care rather than looking at them as just another patient. If you show that you care, you're going to go leaps and bounds forward in developing that relationship and coming to that common understanding. The next one is to initiate a conversation. Try to engage the patient in conversation. Mostly they just want to be heard. And a lot of times when they feel that they're not heard, that's what's going to lead to that aggressive and angry behavior. You can address your patient by their first name and maintain eye contact and be empathetic. Let the patient trust that you understand his or her feelings and practice active listening. So a lot of things that have to do with active listening is your body posture. If you standing there, arms crossed, not really paying attention, not looking them in the eyes, that's almost dismissive or standoffish behavior, and it's not going to be very approachable. So try to be approachable and keep the open hand gestures and the good body language so that they can feel comfortable opening up to you, and hopefully that will help keep them calm. The next one is look for the causes. The potential causes of the behavior are huge. Most patients are dealing with some sort of medical condition or a side effect of a treatment or medication or whatever the case is. And a lot of those things can impact their mood and make them short-tempered. You can try to improve the patient's bad mood and lift their spirits by identifying whatever the potential cause is of their behavior and addressing it. Big one, avoid arguments. So while you are entitled to express your opinion, because that is kind of what we're here to do, is tell them, hey, this is what I think is going on. But you must do it respectfully and make sure that they understand that you're not attacking them. Instead of justifying why they are not getting the attention or care that they feel they deserve or want, simply apologize and reassure the patient that you take care, or that you will take care of their needs. It's like customer service 101. If the patient feels, hey, you guys are ignoring me because I sat in the waiting room too long, be like, hey, I'm sorry that you had to sit here for so long. Don't try to justify it. Be like, we're going to do better. I apologize. Let's make it up to you as best we can. Next one is set boundaries. One of the best approaches is to set limits to difficult patients who make unreasonable demands. So that's somebody demanding that you prescribe them narcotics when they don't need it, like something that happens frequently. You want to make sure those patients understand that you're going to keep a check on their needs and requirements. And then follow through. Make sure you follow through. So if you're saying, hey, this is the treatment that you're going to get, it's going to meet these needs, and you need to follow up. The whole no news is good news approach, in my opinion, while it might be the easiest route, it might anger some patients. So you give them a follow-up phone call, like, hey, we got your lab results back, whatever it is, you're good to go. That's going to go miles to help that patient. So next time they come in, they won't be as disgruntled. And then the other reason why I set boundaries is to protect yourself, obviously. So if you're coming in with an aggressive patient, set those physical boundaries so that it doesn't lead to an altercation or whatever. Or even if it's, hey, my boundary is I'm not going to argue. So if the patient's, looking for that argument, you can just take the time, walk away, calm down, whatever you need to do, and then reapproach it and be like, listen, we're not going to argue. This is what I am going to do based on X, Y, Z, and then go from there. Those are my tips for dealing with a difficult patient. So now, if you guys have any questions, feel free to throw them in the chat. And then here is my contact information if you have any questions, and I can go over the scholarship program, I guess, after the next presentation. Thank you, guys.
Thank you, Dr. Allen. Sergeant Allen, that was great. I'm going to go through mine very quickly. You hit pretty much a lot of the great points. I think when I go over mine, I'm going to talk a little bit about the scenarios you guys might run into in our live competition. We're hoping to do many more of these live competitions, really focused on your patient interaction skills. Um, I think one of the first things to remember is if you ask yourself what makes up a good doctor, like, you could ask your friends, your family, yourself, what do you love about your family doctor? Or just a health professional that you've worked with, a PT, an OT onwards. Chances are the first thing that you say aren't, wow, they have great clinical skills. That's important. And you need that. But if you have the best clinical skills in the world, but no bedside manner, you're probably not going to be described as a great doctor. And I think that's really important to know because before you go into professional school, medical school, dental school, PT, anything like that, those programs, once you get in, they'll teach you the clinical knowledge, but they're not going to teach you how to be patient. They're not going to teach you how to deal with difficult situations, how to mediate conflict, how to overcome and adapt to situations. That's something that you need to develop prior to school or prior to professional school. So knowing that, it's good to think about what are scenarios just like this competition that are not only going to immerse yourself in the knowledge and trends in the industry like healthcare, but also how are you going to apply these conflict resolution skills? That's why being an RA, working in customer service, having positions, whether in or outside healthcare settings, that help you develop these soft skills are going to be so valuable for you in professional school. So just remember that this bedside manner, a lot of the tips that Sergeant Allen provided really hit those home on how you need to approach that. So I'm going to reiterate some things that Sergeant Allen said. I'm also going to talk about some things that set you up for our live competition. So we're going to talk about the importance of asking open-ended and clarifying questions when you're meeting with patients, staying calm, not losing your composure. Something Sergeant Allen really hit on is you need to stay calm no matter what is being brought to you. Obviously setting boundaries, but you need to be able to not take anything personal no matter what's being thrown your way. Utilizing active and reflective listening skills is really important, not just for our patient scenario, but in any time that you're entering a healthcare setting. And I think it's important to remember the adapt, don't react. So you're going to be told some things, don't react because that means you might be taking it personal. You need to adapt to the situation, reframe how you want to say things so that it's not taken the wrong way by the patient. And more than anything, staying positive no matter what you're facing. So Sergeant did a great job talking about the different patient scenarios. So I won't dive so deep into that. But resistant patients are those that are angry, frightened, they're defensive. Some of these patients, when you walk into the room, you're probably going to be given a heads up by the nurse or the person that did the original screening of, watch out, this patient is a little bit upset. And with these type of patients, it's important to avoid conflict. Keep your mind on any triggers that might happen that would escalate the situation. More than anything, try to find out the source of the problem. It might be stress. It might be that they waited a while. There might be a lot of things going on there. Make sure you address it, acknowledge it, don't pass it over. Manipulative patients, and Sardana did a great job kind of really going through this one. They use guilt, rage, and threats or even legal action to get what they want in these situations. So understanding when to say no, and this is where setting boundaries is so important, but being able to set the expectation of the patient on what they need. A lot of these come down to being able to hear and understand the patient and then show them that you care and you're really going to provide some next steps for them. The frequent flyer patients and those, so these are patients that, come to appointments a lot and they think that, anything they've read or maybe even looking at WebMD has kind of created nerves in them of what's going on. And so with them, it's empathy is really vital here, recognizing what's going on. It might be something outside of the condition they think they have. And it might come down to sometimes, what's going on mentally, what's going on at home. And I really think it's important when you're thinking about the whole patient and other referrals you can make on that patient's behalf. patients who somatize, and so this is really individuals who the mental issues they're dealing is kind of coming out in physical states. So this is really important to asking the patient what's going on here, because they might be displaying symptoms of things that are going on because they're stressed out. Maybe they've lost their job, their other mediated some circumstances that's really kind of causing other issues in their health. So trying to explain their symptoms in an empathetic manner, really kind of digging deeper as to what's going on, and providing other referrals, as I mentioned, as needed. So 9 tips for dealing with difficult patients. And again, starting down the hill, a lot of these are just some things that you really need to take in mind, because remember, you're in this live patient scenario, you may see anything. You're going to deal with one patient and you're in there. Your goal is not to diagnose, it's to assess and document. Assess and document and ask the right questions. So make sure you're letting the patient share their story. Pay attention to your body language. And if you're doing this in a team, pay attention to the body language of all the members of your team. During the live scenario, you can decide as a team how you want to approach it. You can have one person talking, one person or the team of you documenting, or you can have multiple people talking. However, keep in mind that when you ask questions, you need to be coordinated. If 2 people start talking over each other, that patient's going to react to that and not react in a good manner. So you need to be on the same page. If multiple people are going to be speaking, you need to coordinate who's going to say what so that you don't speak over each other. You're not speaking at the same time and not getting frustrated. That's important. You need to ask questions, but it's not just the open-ended questions. So if you ask a question and that patient gives you details, you may want to ask a clarifying question like, can you give me more details about this? When did these symptoms begin? What medications are you taking? So forth. Look for the difficult reason. Find out what's going on. Ask them, maybe there's something else that isn't part of their symptoms in terms of stress that they're dealing with. Stay calm at all times. You can see we have a cartoon here where, the doctor's asking, what's going on with the patient. Patient's like, the food tastes horrible. It's noisy in here. It's a real issue. And the doctor's like, nurse, this patient is status to critical. It's like, if you acknowledge their needs as real, which they are, and you take it into account and you really show them that you care, no matter how it seems, these are things that patient was going to calm down for because they feel like being heard. And again, their frustrations may be coming from other things outside of what they dealt with in your office. Make sure you speak professionally at all times, no matter what's being thrown at you. Stay calm, speak professionally, because if you react instead of adapt, your patient is going to go down that rabbit hole and it's only going to exasperate the situation. Know yourself and your abilities, and you and your team get to decide who's going to document, who's going to speak on what, who's going to react. Make sure you be strategic as you do this. Don't take anything personal. These patients, again, as a doctor and whatever setting of healthcare you're going into, you have to stay calm and understand that you shouldn't take anything personal. You should definitely set boundaries, but don't take what they're saying personal. And then find opportunities for empathy where you can understand where they're coming from. So some sample questions, and we're going to be providing a guide to all our teams on the rubric for the live competition and things that you're going to be measured on. But definitely starting the appointment off getting a story. What brings you in today? Tell me about your symptoms. Do you have any allergies? Are you taking any medications? Are you under any unexpected stress lately? How long has this been going on? Again, the clarifying question based on what you're being told. Tell me more about this. Have the symptoms gotten worse over the last few weeks? You need to not just ask open-ended questions. Based on the information you're given, you have to ask clarifying questions that logically make sense. This is where your critical thinking skills as a doctor and in these patient scenarios are going to be so valuable. Some key phrases and strategies, making sure, let me see if I understand you correctly, especially when that patient doesn't feel heard or they're frustrated. I'm so sorry that happened. Let me work on handling this situation so it doesn't happen again. I can see why you might feel that way. These are strategic ways to be able to mediate a situation when that patient is showing frustrations. Using metaphors and analogies when you explain things can also be very helpful. For instance, talking about infectious diseases and the body's immune response as a war with attackers and defenders. And these are strategies you've probably even heard from your own doctor when explaining things. I think one of the key things for our own scenarios is reflective listening, hearing and understanding, and then letting that patient know that he or she is being heard and understood. Finally, dealing with difficult patients is never easy. It's never an exact science because us as individuals, we're all different. We all come from different backgrounds. We all have different symptoms. We all deal with stress and our own symptoms in different ways. Make sure they feel heard, make sure they feel understood. Don't get frustrated. Ask plenty of questions, document everything that is being said, and learn these tips and don't take anything to heart. Use your active and reflective listening skills to show the patient you're being engaged, you care about them. And then more than anything, be calm, be positive, and ask questions. So that was my side of the presentation. Um, but I wanted to turn it over to any questions before I turn it back to Sergeant Allen to talk about the Health Profession Scholarship. Any questions for myself or Sergeant Allen? Awesome. Sergeant Allen, I'm going to turn it over back to you to give us some more information about the amazing Health Profession Scholarship. We know you're going to be a part of our pre-health virtual fair. So, please join us in giving us some more information.
Yeah, absolutely. So the Health Professions Scholarship Program, or HPSP for short, is a scholarship that can go towards medical, dental school, optometry school, clinical psychology school, CRNA school, and veterinary school. It pays 100% of your tuition and gives you a monthly stipend. This year, the monthly stipend is $2,466 every month while you're in school. After you're done with your medical school and residency program, then you serve in the Army as a fully licensed and boarded physician for the amount of time that is agreed upon, depending on how long you use the scholarship for. The service requirement is a year for year. So for every year that you use a scholarship, you owe 1 year of active duty service time. The big cool thing that I like to tell people about is your residency options. The Army has just about every residency out there, and they are one of the top-notch, most technologically advanced residencies that you can get. So you'll get absolutely good training. And the cool thing is that if you are a scholarship recipient, you get put to the front of the line when it comes time to match with Army residency programs. And because of that, just this last year, the Army was able to give 85% of the HPSP recipients their number one residency choice. And then 97% matched overall with the Army residency. So it's pretty incredible numbers. I don't know any other residency scholarship pairing that can boast the same. And hopefully it's even better this year. I am more than willing to take any questions. Otherwise, that is the big things. The only other thing I want to mention is just the kind of prerequisite requirements to apply for the scholarship. There's a couple. One, you have to be fully qualified for Army service. You have to go through like medical, physical, and some of that other stuff. You have to have an undergraduate GPA of 3.2 or higher for medical school. And then you have to be an MCAT score of 500 or higher overall with 124 or higher on each of the subcategories or line scores. And lastly, you have to be a U.S. citizen to apply for the scholarship program. So I am open to questions. All right.
Sergeant, thank you so much again for joining us today. We have a lot of competitors and a lot of people reviewing this video, and I know we're going to have you a part of our pre-health virtual fair, but for leading 3 workshops, putting on a great competition, and I know you're going to be one of the evaluators inside the live competition itself. So thank you again for taking the time today and once again sharing your amazing insights and details about the scholarship.
someone did have one question, Amelia.
Just
Sorry, I
got
don't
a-
know if you guys caught it in the chat.
Yeah, I just saw it. Thank you. The question is, what about the score for dental school? So dental school is a little bit different. There's no minimum GPA or DAT score requirements, but it is a very competitive scholarship. So the higher your scores in your GPA, the more competitive you're going to be. On average, I would say a good score that makes you competitive is like 19 or 20 on the DAT. Hope that answers your question. Oh, thumbs up. That's awesome.
Any other questions before we leave? We let Sergeant Allen go for the day. Great. Thank you again, Sergeant Allen. It's always a pleasure having you on and giving back to our students and always sharing your amazing insights and knowledge with them.
So thank you for having me. I will come back whenever you want. Just give me a heads up. Take care, everybody.